Hi guys, welcome to my channel. Before we get started, make sure to hit that like button and also subscribe to my channel. IBM Watson AI system helps to diagnose disease in Japan patients, so make sure to watch the full video. A personal AI. There is no longer any need to search for evidence that the age of artificial intelligence has arrived. A Japanese woman's life may have just been spared by IBM Watson, an artificial intelligence AI system, according to reports. Watson accurately identified the woman's condition. This is significant because for a while, doctors were baffled because her sickness evaded detection using standard techniques. Therefore, the AI's accurate identification enabled medical professionals to create a therapy for the aforementioned individual, ultimately saving her life. The AI's capacity to process vast amounts of data quickly is the secret to this achievement. Unfortunately, human doctors are unable to perform this task on their own, or, at the very least, they are unable to do so with close to the same level of accuracy or effectiveness. 20 million clinical oncology studies were compared to the woman's genetic data by the algorithm. The patient had a very unusual form of leukemia. It was discovered after that. The woman had first been identified as having acute myeloid leukemia and had received therapy for it. But the reason she didn't improve after receiving the standard therapies baffled medical professionals. Not more doctors, but more computing power is what we need. Even more so for a senior physician in charge of a facility for uncommon and untreated disorders. It is a contentious claim for anyone with an interest in healthcare. But Dr. Jürgen Schaefer, who is in charge of treating the most puzzling illnesses that come into the center at the University Hospital in the German town of Marburg, is skilled at finding solutions to seemingly insurmountable issues. Schaefer, sometimes known as the German Doctor House, has now discovered a way to treat a growing number of patients, each with a complicated medical history, without hiring a new group of medical professionals. This is in contrast to his earlier work, which focused on identifying the illnesses that had eluded many doctors before him. Now, researchers at Marburg University's Center for Rare and Undiagnosed Diseases are studying if Watson might contribute to the identification of diseases that physicians might see only once in their lives. The patients who come to the center typically have inch-thick medical records that are jam-packed with unstructured data, X-rays, lab findings, doctor's notes, scans, and more, and have previously been handled by tens of medical professionals before arriving in Marburg. The doctors at the center might spend days poring over these records in an effort to understand all the data they contain and make a diagnosis. Patients that arrive at the center are extremely difficult to manage once they arrive, and we are busy for a couple of days just reviewing the paperwork, Schaefer said. It is obvious to us that either we keep using the outdated method of organizing massive amounts of information on paper and sifting through it over the course of days or weeks, or we set up a new system where its support screens the results and distributes the information, the report reads. Future plans call for feeding Watson all of this data, letting it process it, and then handing back a differential diagnosis, a list of possible illnesses that could all fit the patient's symptoms, so that human medical personnel can determine which of those conditions the patient actually has. A potentially unusual result can be highlighted by Watson if it is found among all the data, allowing clinicians to investigate it more or ignore it and run the test again. Although Schaefer argues there may be drawbacks to such an approach, Watson may theoretically help the diagnosis by weighing each of the ailments in the differential diagnosis according to their likelihood. We are debating whether to use this, but it's risky because if you say this or that is the most probable condition the patient has, you'll focus on that first, the doctor warns. But if the patient is among the 1% of patients who also have the other disease, it does not assist. We must be certain that Watson would deliver the likelihood, or there is a risk that the doctor may eventually stop thinking. If there's a 90% likelihood that it's a myocardial infarction, that's good enough. But a 1% possibility that it's an aortic dissection, which is also a fatal condition, you take the chance that nobody will consider this. Using this functionality is something that we are actively debating. Within the next few months, the center hopes to launch the Watson system. The facility will roll out a 1,200-question digital quiz that patients fill out to aid in its diagnosis. The data individuals provide will be loaded into the IBM system to offer it further insight into variables that could affect the diagnosis, from their symptoms and family history to the environment they live in and their work. Before being sent to the cloud computing platform, IBM Bluemix for processing, the data will be anonymized. Additionally, Watson will be able to translate the information from German to English, so that it may be compared to medical terminology there. The approach might also be used in the future to recommend additional tests that could be performed to narrow down the diagnosis by ruling in or out particular illnesses. On patients who have already visited the clinic and had their problems diagnosed, the system is currently being evaluated in the past to see how well it performs. The 12-month pilot program may be expanded if it is successful across the 5 facilities owned by Ron Clinicum, which includes the University Hospital, which has 5,300 beds in specialties such as neurology, oncology, or emergency care. In the long run, we are going to apply this in the emergency rooms or the admissions office of all our hospitals, so if patients would show up with certain complaints, we would be able to identify them and get them the appropriate care, said Ron Clinicum. With this information, the emergency room door would be wide open. If they exhibit symptoms of a stroke or chest pain, the system could be set to alert and page a radiologist, cardiologist, or neurosurgeon to clear the CT scan, so that there are no delays with these critically ill patients. Potentially, such remotely managed HIT systems could be utilized as a beginning point for the treatment of patients from remote areas where medical professionals are few and far between or locales that don't have the suitable specialists for their ailments. But Schaefer argues that its solutions should be used to serve highly qualified, motivated doctors rather than to take their place. Even more so for a senior physician in charge of a facility for uncommon and untreated disorders. It is a contentious claim for anyone with an interest in healthcare. But Dr. Jurgen Schaefer, who is in charge of treating the most puzzling illnesses that come into the center at the University Hospital in the German town of Marburg, is skilled at finding solutions to seemingly insurmountable issues. Schaefer, sometimes known as the German Doctor House, has now discovered a way to treat a growing number of patients, each with a complicated medical history, without hiring a new group of medical professionals. This is in contrast to his earlier work, which focused on identifying the illnesses that had eluded many doctors before him. Now, researchers at Marburg University's Center for Rare and Undiagnosed Diseases are studying if Watson might contribute to the identification of diseases that physicians might see only once in their lives. The patients who come to the center typically have inch-thick medical records that are jam-packed with unstructured data, X-rays, lab findings, doctor's notes, scans, and more, and have previously been handled by tens of medical professionals before arriving in Marburg. The doctors at the center might spend days poring over these records in an effort to understand all the data they contain and make a diagnosis. Healthcare's future. Professor Satoru Miyano, from the Institute of Medical Science at the University of Tokyo, notes that this is unquestionable evidence of AI's capacity to change the world in the ensuing years. According to Seiji Yamada, chairman of the Japanese Society for Artificial Intelligence and researcher at the National Institute of Informatics, this is the first instance of an AI saving a life in the country. He calls it the most practical application of artificial intelligence in the field of medicine and healthcare. It's crucial to keep in mind that the medical industry has used AI in similar ways before. One example is the support it provides for the treatment of leukemia and brain tumors in the United States. Therefore, this case actually represents merely another audacious stride into the age of artificial intelligence. So that's it for today. We hope you enjoyed the video. Use the comments section below to tell us your thoughts about the video. Also, make sure to subscribe to our channel and click the bell button to be notified of all the latest videos.